Bob Challoner, the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly program about the goings-on here at your community hospital. Today we have a special program. Often you hear from our providers. Today we actually have one of the patients who've been through a program with us today. And I'd like to welcome Dr. Medhat Allam, who is our Chief of Bariatric Surgery at the hospital, and one of his patients, Ms. Brenda. Thank you both for agreeing to be on the program today.
Thank you.
And today's program will be talking about weight loss surgery and the options that are available. An important topic. Many people are struggling with obesity in this country, and there are many different options available. Dr. Allam is the only bariatric surgeon on the South Fork and a long-time expert in bariatric surgery, and we'll talk a little bit about his training. And Ms. Walker has been a patient and been through it, and we're happy to hear your experience and what this is about. So maybe we'll start off, Dr. Allam, if you could just talk a little bit. People always like to know who are these doctors that are taking care of me and what's their training, and talk about your as the head of our bariatric program, you've been through some very extensive training, actually, and talk about that a little bit.
Sure. I'm a general surgeon by training. I graduated in 1996 from my general surgery training, and I went in the field of advanced laparoscopic surgery. In 2001, when bariatric surgery became more of an acceptable treatment option for obese patients, particularly morbidly obese patients, I underwent training into the bariatric surgery, and I started a program in Southampton, and it grew nicely ever since, and we've done taking care of thousands of patients ever since.
And we've had the program here at Southampton ever since you completed the training?
Yes, ever since 2001 we started the program. It's been an ever-growing program.
And I know that thanks to your help, we've become a center of excellence, a certified center of excellence also.
Correct. We are certified by the American College of Surgeons and American Society of Bariatric Surgeons as a center of excellence in bariatric surgery.
Which is a very rigorous process, actually, to go through, and a lot of issues around safety and training and process and care.
Yeah, to get that designation, you really undergo an extensive research by the American College of Surgeons. They make sure that you have the facility up, to date with every equipment, and your outcome is above average.
Right.
And we had an excellent outcome.
Great. Obesity is a major epidemic in this country, and we all know the statistics, and a huge proportion of Americans are overweight. And often we minimize it. We often think, well, somebody's a little heavy, they've gained too much weight, but there are very, very serious health implications for being overweight. And would you talk a little bit, Dr. Allam, about some of the issues and the health challenges for people that are overweight?
Sure. First, let me define what we consider a candidate for surgery or morbidly obese patients. The weight by itself is not an indicator of a person condition, because somebody who's 6'2" and 220 pounds will probably be within a normal weight, while the 200 pounds or 220 pounds goes on somebody who is 4'11", and that person will become obese. So they created an index called body mass index, and it divides your weight by your height using the British system of kilograms and centimeters, and it gives a number. And if the number less than 25, you are considered a normal weight. When it starts going up to 25 to 30, you are overweight. When it hits 30 to 35, you become obese, and 40 and above, you are considered morbidly obese. In the United States here, there are around 60 million overweight individuals, and around 40 million severely obese individuals, and around 4 million morbidly obese individuals. So it does not come without a price. Once the weight comes on, your body, your heart, the vital organs in your body, your heart, your lungs, your vessels were designed to deal with certain volume and certain size. When the weight start coming on and on like that, these organs will start failing. It's not a sudden failure, but the problem that it becomes progressive chronic illness, such as high blood pressure, the heart disease, stroke, diabetes, gallbladder disease, and on the last 5 to 8 years, we discovered that the rate of cancer in certain instances doubled when people had 100 pounds or more.
Doubles, really?
Yes, particularly breast cancer and colon cancer. The rate is getting higher and higher as individuals gain weight.
Wow. And the issue's really not plateaued. It seems like, from what I read anyway, the obesity epidemic continues to grow in the United States.
Yes, unfortunately, now the statistics show that 4 out of every 10 kids are overweight already.
Right.
So it's going to take a cycle, I'm sure, and we hope that the epidemic will disappear eventually, but it takes a generation or two, just like smoking. When everybody smoked and the statistics start showing that smoking is related to lung cancer and all the side effects of smoking, it did not stop overnight. People continued to smoke, but it took a generation or two before we found that the curve started going down.
And I know there's, in addition to organ failure, there's so many other joint problems, and you hear people issues with their hips and their knees and other problems with their skeletal system even.
Absolutely, osteoarthritis and back pains and neck pains and knee problems, all that are a major complication of weight.
So what I'm particularly interested in, and we often hear people say, surgery is such an extreme move for somebody who's overweight to get bariatric surgery and to go through the surgery. And I think it's frightening to a lot of people. And you'll often hear people say, why don't you don't eat as much or just lose weight? Yeah. Not so easy, right? It's a
very difficult. Right. Weight problem is not a single factor, it's a multifactorial problem. So the typical attitude of just stop eating or so, it's just like telling people stop smoking, or it's a multifactorial. There are a lot of emotional factor, there's environmental factor, there are genetic factor, many factors leads some person to become morbidly obese, and for that person to lose weight, it's either using traditional methods such as diet and exercise, which we encourage all patients at the beginning to try them. But ultimately, if patients fail once and twice, they become more and more depressed and less likely to succeed. And that's when bariatric surgery comes in. In the good old days, it was a suggestion or maybe like recommendation by a physician. But now the American Medical Association, in its publication, indicated that weight loss surgery is the recommended procedure of choice for patients who are morbidly obese.
And I also know that the dieting is very often ineffective. People may lose a tremendous amount of weight and then they put it back, and it just makes it that much harder the next time too. There's a metabolic effect, right?
Yeah, the statistics show that 97% of patients who actually go on diet gain more weight.
Really?
So the success rate, unfortunately, with diet is around 3% only.
Really? Interesting. So let's talk a little bit, and then I'd like to also talk to Brenda about your personal experience and why you chose. And before we did that, talk about a little bit about the surgical options, and when should somebody start to think, maybe it is time for me to think about surgery. I guess let's answer that question first.
Yeah.
When should I think about surgery?
A patient who is 80 pounds or more should and have failed diet.
Right.
They should consider sooner than later having some intervention, one of the weight loss surgery, because once you fail once and twice, the success rate, even with diet, becomes less and less than 3%. So to begin with, the 3% is not like that great, but with the second failure and the third failure, the success rate start going down. So once a patient is 80 pounds or more, once the patient starts suffering complications of weight, such as high blood pressure, diabetes, or a heart disease, or any of these factors, knee problems, back problems, they should discuss it with the primary care if weight loss surgery is an option or not.
And many of those problems are reversible. I understand also that I've heard stories of people that have seen their diabetes start to reverse. And,
the great thing about weight loss with bariatric surgery or weight loss surgery comparing to weight loss with other is that these what we call them comorbid conditions, such as high blood pressure, diabetes, heart disease, etc., they reverse in the vast majority of patients. Particularly diabetes, if the patient had diabetes for less than 15 years, there's almost 90% chance of that diabetes going away completely.
Really interesting. So it's never too late really to get started.
No, it's not.
And Dr. Allam, before we talk to Brenda a little bit about her experience, I know that you performed 3 different types of bariatric surgery. What are those, and when would you do the different types of surgery?
There are 3 different available or most commonly done procedures now in the country for weight loss surgery. One of them is called gastric bypass, and that's a procedure where we do not remove anything, but we make the stomach smaller and reroute part of the small intestine to decrease the absorption of food. And that's a commonly done procedure. It has a great success rate. Most patients will lose between 70 and 80% of the excess weight within the first year or 18 months.
Wow.
It has also pros and cons like everything in life. It has a complication rate. Interestingly enough, the death rate, because your first question was, the people think that it's like drastic. It's actually the death rate from complication related to weight loss surgery is less than death rate for hip replacements.
Interesting.
Yeah.
And it's funny, it does have a perception that
Yeah.
bariatric surgeries are much more risky.
And the reason behind that is at the beginning, many years ago, the operations were done in an open fashion.
Okay.
The training was not as great, expertise were not available, so there was a lot of complication at the beginning. And the media took hold of that, and all of a sudden it created a very bad reputation. But the complications rate dropped significantly over the course of the past 10 years, and it keeps dropping. Back to your question about the different procedures. Apart from the gastric bypass, there's another operation called sleeve gastrectomy. And in that operation, we remove a big section of the stomach, leave only a small sleeve of the stomach connecting the esophagus to the intestine, and that decreases the amount of food that the patient can eat. And also by removing that part of the stomach, it takes a big chunk of the stomach where hunger enzymes and hunger factors are produced, so the patients are less hungry.
Okay.
And the last commonly done procedure is the lap band operation, and that's actually an outpatient procedure where, as Brenda had,
Are the other 2 procedures inpatient?
inpatient requiring 2 nights stay in a
Okay.
hospital, while the lap band is an outpatient procedure where there is a small rubber belt lined inside with a balloon that's placed around the top of the stomach, creating 2 portions of the stomach, top portion and lower portion. And the top portion where the food comes down first is small, so patients feel very full very quickly.
Okay.
And the 3 operations at the end of 5 years, more or less, will have the same outcome.
I see.
Just to simplify it.
Okay. And clearly the choice of which one of those surgeries would be something people should speak with their doctor and you particularly about, because I would guess there's different reasons for doing the different types of surgeries.
Correct. There are different reasons for avoiding one versus one, and it depends upon the patients and their past medical history and their current, commitment to weight loss and commitment to themselves to adhere to all the recommendations and instructions. So usually it's a nice discussion that I have with every patient before we come up with a conclusion as to which procedure is appropriate.
Okay. And Brenda, I'm particularly interested in your experience, and thank you so much for being here. It's rare that we have an actual patient who's willing to step forward and talk about their experience, and it's important because you can, all the folks that are considering this, it's important for them to hear from somebody who's a colleague or a peer and know what's happening. Tell us a little bit about your experience. What type of surgery did you have, and what led to your decision making?
Well, I had the lap band done, and I had it done in 2011. And the reason why I decided to do the surgery is because I had tried different things, weight loss, and I couldn't do it. So I decided that I would have to do the lap band.
Right.
And I had diabetes, which I don't have any diabetes anymore. I don't have to take any medication
Wow.
anymore for it.
Totally reversed at this point?
It's reversed.
Wow.
No medication. And then my blood pressure has dropped down to normal now. I don't have any problems with that. And I did have sleep apnea, and that's gone away too.
Wow, that's amazing. So
Yeah.
what in the procedure itself, how long a period of time did you go through making that decision? Did you go through you went through the sort of the bouncing back on diets and things that people?
It took me 5 years
5 years.
to
Wow.
decide to do it.
Wow. You wish you'd done it earlier at this point?
Yes, I
Yeah.
do. And if I had to do it again, I would do it again.
All right.
I have been very successful with it, and I'm very happy with
That's
it.
great. Well, you look great. You look great.
Thank you.
It's that's the sort of outcomes that we want when we see that sort of reversal of illness. Frankly, it's
She had lost 130 pounds or
130
a
pounds.
year and a half since she had the surgery.
Wow, that's tremendous. That's
Yes.
great. That's great. What's it? I know people wonder what actually happens to your eating patterns and things. Are you eating much smaller portions, or do you still feel hungry, or how has it affected your appetite?
No, I don't feel hungry anymore, and I'm not able to eat as much as I used to. I have to have small portions of what I eat, and you know, it fills me. And then I whatever drink or whatever or eat, I don't have any problems.
Right.
Yeah, so.
So that's been a major change in your. Did you have to buy an all new wardrobe? I guess
Yes,
at this point?
I did.
That's probably the way you treat
Yes, I did.
yourself, right? When the time
I've
comes.
gone down like 6 sizes.
6 sizes. Wow,
Mhm.
that's remarkable. Are you
Yeah.
still losing weight? Is it
Still
something-
losing weight.
Wow, that's
I
incredible.
haven't met my goal yet.
Yeah, congratulations. Now, you have other things. It's not just about the surgery. There's also, you go through nutrition counseling and other things as well. Have you done that?
Yes, I have. Yes, I have. Every once in a while, and I have gone to the support group meetings too, which is very helpful.
Right.
And, we learn how to get different recipes, different foods that other people eat that, we didn't think about eating.
Right.
And the dietitian is there anytime we need to go and get a consultation or anything.
That's great.
Yeah.
I bet you're an inspiration to some of your friends and family too.
Yes.
They must be very proud of you having made this step. So.
Yes, they are. And it's been a very good change for me, because at first when I was working on my job, I could not stand for 8 hours
Okay.
without my feet paining me or anything else. And
Right.
now I don't have any pains in my feet or my legs, and I'm able to stand for 8 hours.
Wow.
And I've also exercised before, take a walk about 2 miles and then go to work and work 8 hours, and I'm fine.
You think it's leading to encouraging you to change your lifestyle generally, to be more active and more careful about diet, obviously, but do you think it's motivated you to make changes in your lifestyle?
Yes, it has a
Yeah.
lot. And I even go to a Zumba class every week.
Oh, great, good for
And
you.
I used to could not do it
Not
at
something
all.
you want to do anymore. Wow.
Yeah.
That's got to be so great to go through those kind of changes.
Yes.
I know that Dr. Allam usually has an annual holiday party with some of his patients show up, and I've heard people talk about how they would never get out on the dance floor before, or the new wardrobe that they have, and it just really brings back a quality of life that's
It
just
is.
remarkable.
It is.
So,
We say you gain weight,
right.
you get comorbid condition, your quality of life goes down, and there's premature death.
Right.
And that's a problem with weight. Once the weight loss happens, patients become very active again. They regain their life, basically, you know. They are able to participate, you know. They're able to take care of their kids, run around with them, or grandkids. They're able to be part of life rather than just sitting on the side of life. And that's a great thing.
And I think that there's a misperception too, that weight loss surgery is somehow a cosmetic only kind of procedure that, but it really is a disease that will kill you.
It is not cosmetic
Right.
operation. It's approved by all insurances as a
Right.
treatment of a disease.
That's right.
It's not like, you're having, a breast implant, or you're having, some liposuction.
Right.
It is a terrible disease that leads to so many comorbid condition and complication, and eventually premature death. So it is not a cosmetic operation.
And just to back up to the complications, did you have any issues after the surgery, or how any uncomfort with it? Every surgery is a little risky and has a certain amount of recovery period. How quickly were you able to really get back to normal?
I was back to work in 2 weeks.
2 weeks, wow,
I was
that's
back
great.
to work. Yes,
That's great.
standing on my feet for 8 hours.
Wow.
So it was a pretty quick recovery.
And you had the laparoscopic lap banding surgery,
Yes.
which is minimal, minimal
minimally
number.
invasive.
Are
Yeah,
all of the surgeries done with minimally invasive?
All
method?
operation that I mentioned earlier are done with laparoscopic or advanced laparoscopic surgery, done
Right.
through 2 or 3 cuts. So the outcome when patient looking outside, it looks like they just had like little 3 Band-Aid when they leave the hospital. With the lap band, as in her condition, they go home the same day.
Right,
And they can drive the car within 48 hours.
right.
In 5 days, there is no restriction on any physical activity.
Within 5 days,
Yeah.
that is truly
In 5 days,
remarkable.
I don't know how long did it take her to drive after she left the hospital, but how long did it take you before you start driving?
I think the 4th day
The fourth issue.
I was
day.
driving. Mhm.
That's tremendous. And again, just a little bit, some folks with the concern about, I mean, one of the things that I've learned through talking with you, Dr. Allam, and actually seeing some of your patients, the risks of not doing something when you become obese are frankly so much greater than the actions you can take.
Oh,
So-
absolutely. The risk of continuing being morbidly obese comparing to the possible risks of the operation,
Right.
there is no doubt in anybody's mind that there is more risk with not doing anything. Just the mere fact that the rate of death of morbidly obese individuals 12 times their peers who are normal weight is very scary.
Right.
You know, the complications of weight gain, you gain your weight, you get diabetes, and then the complications of diabetes after that, whether it's cataract or loss of vision or ischemia to legs and hands and feet and gangrene and all these complications of complication. So it's a cascade and has to be stopped.
Even the impact on the heart from diabetes and the arterial system, it's, I know, and people are under this misperception that medications, we can take care of the diabetes with medications and things.
Yeah.
It's still it's a disease that still continues to
Yeah.
proceed. And
Yeah, well, medication for diabetes do not treat diabetes. It treats the symptoms of diabetes. So your blood sugar is maintained, but still the diabetes is causing complications inside your body, even when you normalize the blood sugar with medications.
And just in terms of the goal, typically you said you had a goal to lose weight. I know that some people think that, and sometimes get a little frustrated too. They think that I'm going to have the surgery and I'm going to look like a magazine model and be as skinny as a magazine model, which I don't know is such a healthy image
Yeah.
anyway. It doesn't work that way for everyone, right?
We go through a lot of education beforehand, so patients have realistic expectations.
Okay.
You do not think when you are 50 years old and let's say 400 pounds that you're going to turn after surgery and be 130 pounds and 18 years old.
Right.
You know,
Right.
you're not going to bring time back.
It won't grow my hair back.
Yeah.
Right.
So we're trying to give the patient enough education because one of the main reasons of failure is unreasonable expectations.
Right.
So we go through a lot of education between myself and the dietitian and a psychologist to educate our patients about what's going to happen with them, what the difference in diets, how they're going to progress, what the phases of recovery, and what expectation they should have.
Right.
And it's not a number somewhere, it's a lot of issues to come together to come to what's my goal.
Right. And you said you're getting closer to meeting your goal. I think you said how many pounds?
She was 130 pounds.
130 pounds. That's terrific.
And hopefully by the end of the year, I'll meet my goal
That's great. That's great.
and maintain it.
Maintain it. That's the key. And I think that's part of the key for the surgery as well, right? It helps
Yeah.
people maintain it, whereas diets
Yeah, they
reverse
bounce
so
back.
quickly.
Yeah,
Exactly.
I hear you with the diets.
Let's talk a little bit about what you went through just prior, the sort of specific steps in terms of, we don't just sign somebody up, put them in the operating room, and some of the specific counseling and things that you went through as well. Can you describe that a little bit, Brenda?
the things that I went through before.
Right.
Well, I had to go see the nutritionist, the first thing, and I had 6 months to see my regular primary physician, and they had to, just monitor me a little bit to make sure that I was able to, go through with the surgery, and I ended up going with it. But the thing that really led me into going into the surgery is because of the diabetes, and then I had went to the cardiologist and took a test, and he told me that I need to really do something with my weight, else I was going to have more complications down the road. So
that was your inspiration. You knew that it was going to be, not good. You're shortening your life, frankly.
Right.
It's a remarkable change, and especially to hear the reversal of the complications that you're having. That's pretty typical, Dr. Allam?
Yeah, I would say the vast majority, 95% of patients will have complete resolution of diabetes and high blood pressure and the potential risk factor for heart disease and stroke.
Right. A couple of the myths that I've heard about that. One is the complication rate, which, as you've described, they are very, very small at this point. Every surgery has risks associated with it, but you have to weigh those risks against the risk of not doing something. The other one I've heard somebody just recently said, "Oh, I wouldn't get that surgery because I'll starve to death. That I'll just keep losing weight to the point I'll essentially disappear." So
there's a lot of misunderstanding about weight loss surgery. One of them is that you're going to be eating like garbage baby food for the rest of your life.
Right.
That's completely, myth.
Right.
Patients eventually, after the first 6 weeks, we will put them in a progressive diet.
Okay.
So they're relearning how to eat and treating the new stomach,
Right.
I should say, in a decent way. And then eventually they're going to eat whatever they want to eat that agrees with them in a small quantity.
Right.
So it's not like they have like boxes and boxes of garbage food.
Okay.
That's one thing.
Okay. You're not going to be drinking out of a straw or eating
No,
your meals through a straw.
absolutely not. And the other thing is that I'm going to starve. All weight loss surgeries are designed to take the hunger factor away. So patients with a small meal are very satisfied the same way they would have been satisfied with a huge meal.
And why is that? Why would you have less hunger all of a sudden?
Because either the operation will alter the hormone that causes hunger, or the pouch that's created will be filled very quickly with a small diet and create the sensation of fullness, which prevent people from feeling hungry. So I would say 100% of patients will feel very satisfied with their meal. It's a small meal, but it's regular food.
Okay, so no baby food, and you won't fade away into oblivion.
No, absolutely not.
All right.
No, we haven't had that yet.
That was somebody recently mentioned that to me. And also, just any parameters around age, Dr. Allam? Is there, it's interesting. I've heard people say, well, the very old, but often very heavy people don't make it to an old age, unfortunately. Yes. But are there age restrictions, both young and old, that you consider?
The criteria we use in our hospital and in any other center of excellence for bariatric surgery is age 18 to 67 or so. We do not do pediatric patients in our hospital, but there are centers, because a lot of weight loss surgery are approved for adolescents. So there are centers, but we do 18 to 67. Patient should have tried at least once or twice to lose weight using traditional methods. Patient should be not addicted to drugs or alcohol. These are basically the criteria we use in our program, and 80 pounds or more.
Great. Okay. Well, we're out of time, unfortunately, but I would like to I'd like to thank you, Brenda, for being here and sharing your story and being motivation, hopefully, to some of our people that are watching. I really appreciate your being here today. And Dr. Allam, I have to personal thanks to you. You've really been the champion for this program. If it weren't for you, we wouldn't have this kind of a program on the South Fork, and we're proud to have you as the leader of our program here at Southampton, and wish you much future success with it. Anyone who's watching, if you'd like more information, I know that we'll be displaying on the screen the numbers for how to get a hold of Dr. Allam. He's a wonderful resource. Can answer your questions. You can also, if any of you have questions just navigating the health system in general, Please feel free to call my office at 631-726-8555. And please, if you are struggling with weight, there are many different options available. Don't struggle with the problem silently. Call Dr. Allam, call the hospital, and we'll find the right resources for you. Thank you for watching today. Thank you to our friends at CTV for producing and airing in Southampton, and of course to our friends in LTV in East Hampton for showing in our East Hampton communities. Please call us if you have any questions. Good health, everyone.